NDEB has recently updated the criteria. And today in our podcast, we're going to be going briefly over these changes and how will they impact the practice. Also, we're going to be going over the clinical skills course itself, how to maximize your benefits. So that's why we have Dr. Bana Al-Ani, the Director of Clinical Skills. Welcome, Doctor.
Thank you, Dr. Ubay, and welcome everyone.
Dr. Ban, the updates. How huge they are. Are they going to impact the practice? Tell me more about these updates.
The updates themselves to the criteria for us, it's not a huge. Like if you look at them, they are refinements of the criteria. Some of the points now making more sense. Our evaluation is already strict and we align with high expectation.
Yeah.
So for the updates here, if you look at them, things made more clear. For example, MOD. Preparation. We used to tell people you should get a clearance. Clearance used to be minimally competent.
Yes.
But we used to tell them you should get the clearance with the adjacent tooth because if you don't have it, most likely you're still in the contact with the adjacent tooth. There might be damage, high risk of damaging the adjacent tooth. And there is high risk also of leaving some unsupported enamel that might fail the project. Now they made it simple, straightforward. No clearance is a fail.
Yes.
So made it easier for us. Other thing, for example, endo-access preparation, that one word change in the external outline form used to be outline form, shape, position that prevent access to the canal. Now they change prevent, outline form, shape, restrict access. It's a fail, meaning you should go bigger. It aligns with our recommendation that you should make your endo-access preparation bigger. So yeah, the changes for me, they don't seem big or huge. No, they make perfect sense. And everyone who's training under strict, well-structured course, like the one we have here at Prep Doctors, shouldn't worry too much about the changes. They are not dramatic.
And it was not the first time, though, to update the criteria.
Yes, there has been changes,
Yes.
Like from time to time. And I think, in my opinion, the board also wants uniformity. More than 1,000 of candidates are being evaluated throughout the year across the country. So having these small unclear things can create inconsistencies. And also they want to reduce the interpretation differences between examiners. Yeah.
For summary, you think they're just making it clear at the end?
Exactly.
Okay.
Exactly.
I understand that the criteria they made it more clear. And but there was one change that most of the candidates are talking about, which is the light contact.
Yeah.
It used to be minimally competent, so I think they were lenient about the contact.
Yes.
Now they moved it to the non-competent part.
Yes.
So tell me more about the contact, because most of the candidates are asking about the contact in particular in
they
the
are
updates of the criteria. Yes.
About it. Now, yes, some borderline competencies move to the non-competent. Now, in real life, if you have a filling with inadequate contact, you cannot expect long-term function of that filling.
Yeah.
Light contact, food impaction, and they mentioned that. So just don't focus on how I'm gonna pass and if I have a light contact. No. Follow our guidelines. You know how we check the contact.
We were strict with checking
Very
contact.
strict.
Yeah.
So we don't rely only on the snap of the floss because the snap can be false snap. We check with the thin matrix band. And we hold the typodont against the light to check precisely the contact with the
I was one of the candidates who used to argue over the matrix band. I remember telling them light contact is minimally competent. Why we are checking with the matrix band?
Exactly.
But now it makes more sense right now. Yeah.
So just follow our guidelines. Be strict with your measurement, with your checking, and you should be okay on the safe side.
Yes. Yeah. I agree.
And don't argue.
Okay. Regarding the updates, I can tell everyone that it's going to be fine. Once you join the course, you're going to be finding the full support and guidance from us.
Of
but
course.
Now let's talk about the clinical skills course in general. We are approaching a new cycle. A lot of ACJ candidates are going to be joining soon once they pass.
Yes.
So how to utilize each component of the clinical skills course and to get the maximum benefit out of it?
Now, let me,
let's break down the components of the clinical skills course.
I'll talk first about the course, how their week will look like. The course usually, the roadmap, we offer 2 cycles of 12 weeks each. So the 12-week, 1 cycle, if we break down the week, there will be lectures, weekly lectures. We will introduce topics in the lecture. Then we have demo. They have to watch the demo library. We have it as well. And we have also, while they are practicing on the project, after watching the lecture and the demo, they have also lab support, meaning instructors will be inside the lab on floor to support them if they need any assistance. We have the 2 sessions per week. Each is 40 minutes, one-on-one work check session. So they work on a project and they have 2 sessions per week. They go to the instructor, they check their work with the instructor. Now, in the second cycle, we have also tips and tricks, 2 sessions. I'm going to explain the tips and tricks. We have also in each cycle, we have the walk through the exam lecture and the conclusion lecture.
Okay. Let's start with the lectures.
Okay.
Yes. Tell me more about the lectures, how, because candidates, when they attend the first lecture, it's overwhelming. So tell me more how to get the benefits out of this lecture and what's the best way.
So the lecture is the first thing you're going to get. My advice always is attend, rewatch. Attend and rewatch. So you attend the lecture for the first time. Especially the cutting projects, a lot of explanation, a lot of numbers and measurements. Candidates, they get overwhelmed in the first few lectures. So our advice, take notes. I'm sure that no one is absorbing the lecture 100%.
Yes, I agree.
Take the notes and start working on a project. Things will make more sense. The things we talked about in the lecture, they weren't maybe clear to you in the beginning. After you work, you get the guidance from the instructors. Again, make time for yourself to rewatch quickly the lecture. It will now be absorbed 100%.
Yeah, totally right. Because the first lecture, I'm going to take personally, when I attended, it was like, okay, what's Dr. Bont talking about? I don't understand all the criteria.
Yeah, they can't imagine fully what is unsupported in our,
yes,
what is,
it was until I made my first project, things made more sense.
Exactly, because when you work on the first project, you will experience the mistakes. You move the project to the work check, they will guide you. Now, if you rewatch the lecture again, things will make sense.
Yes, you're totally right.
Exactly. Now, my advice in the beginning, especially the first 8 weeks of practice in the first cycle, if you can make time during those 8 weeks to rewatch the lectures will be very good, because you have also situational judgment component,
of course,
and things will be heavy on your shoulder later as you proceed with the 2 courses. So if you can make time from beginning to rewatch the lectures, it will be very beneficial. If not, in the second cycle, we advise you to attend every Sunday the lectures, although you did, but it will be way more helpful.
Okay, so they finish with the lecture. The second day, they will be in the lab. They will have, they need to watch a demo for that.
Of course. And we have demo library. It's a very rich library. We have, for example, MOD. You have it on molars. You have on upper and on lower, on premolar. Same thing with PFM. Same with other projects. So you have it on multiple teeth.
Just to get the differences between every tooth.
Exactly. So you can watch the demo. And you have also the luxury of, you have the tablet next to you in the lab. So some people, they play the demo and then they stop it. They work while the demo is there working. So so this is the demo library. We have also something called prep shorts. The prep shorts, these are short videos, about 4-5 minutes average. It will show you how, after you finish your project, how you evaluate your project.
Yes, it's very
because
important.
Because you have to know how to evaluate. You're going to be working in the exam on your own and submit these projects, so you should know how to evaluate it.
You know the criteria, but you want that criteria to be implemented in the project.
Exactly. So it's review to the criteria on that project.
Yes, and make sure that you check every part.
Exactly, and you check every single column.
Okay, and for the lab support?
Now, lab support, we have instructors on days of lab support. The instructors will be inside the lab. It's not work check.
Yeah.
Utilize it properly. So don't take the projects you're working on to the instructor and you tell them during lab support, check my project, because you have other 2 sessions to check your project. Instead of that, you're having a problem with breaking contact or whatever problem, damaging adjacency. Just ask the instructor, like, can you show me how to do this? Like, you prepare everything, but that contact you're struggling with, tell the instructor, can you show me how to do it? It will accelerate your progress in the lab.
So basically, it's a help, it's a support in the lab support days to make the projects, not to check the projects.
Exactly. Not
because
to check.
sometimes you know that you have a mistake, but you want to know how to fix that.
How to fix it,
Yes.
or how to proceed
with
because
the project. Yes.
it's now the other thing, sometimes in lab support, it's according to the demand as well. The instructors also sometimes they gather a group of candidates and they do live demos. We have the demo library, we have live demos during lab support. They get benefit, like they see the seating position, how to properly, the ergonomics, and how to properly, because we have the infection control side as well.
Yes.
You have to take care of that. So they perform the project live in front of the candidates as well.
And now let's move. They finished with the lecture. They took lab support. Then they have to check their work now.
Exactly.
So just walk me through the work check sessions.
Usually you have 2 sessions per week. Each is 40 minutes.
Yeah.
You have, like, especially in the beginning, you can do it anytime, but I think it's more beneficial in the beginning of the course, the first cycle especially. You can book your session with the instructor, you go to their offices and they do the work check for you. And during work check also you can ask how to fix these things, because they have the handpiece, they have the units with them, so they can show you. And sometimes people, they get shy, like they are shy to ask the instructor. No, don't be shy. If you have a problem, you want the instructor to show you how to fix that problem, they can do it during work check. Now, this is one thing of work check. The other thing, you can do the opposite. Instead of you going to the instructor, you can book what we call it supervised session. Supervised session, especially in the beginning, you have a consistent problem that keeps happening. You know you have it and you don't know why you have this problem.
Like every time in work check, you have a pattern of mistake.
A pattern of same mistake, over convergence, for example. Instead of having that mistake over and over, and you know you have it, don't do that project and take it to the instructor. Book the supervised session, let the instructor come to your station, and they will be supervising you. They will watch you while you're working on the project, and they might guide you what's going wrong. Like maybe it's just like simple, the way you're holding the handpiece, or
Yeah, just the angulation sometimes. Like it's good when you have an instructor guiding you throughout.
And it's
the
beneficial.
project.
It helps
very beneficial,
people.
Yes.
Yeah. So sometimes don't insist on taking your work to the instructor and you know you have a problem. Call them to your station through the supervised session, and they will help you to see what's going wrong with your preparation.
Nice. And now, at the end of the second cycle,
Yes.
We have the tips and tricks session. You mentioned you're just going to be talking more about it, because tips and tricks session is focusing more how to manage the complications.
Exactly.
So
now this session, we hold these sessions twice during the second cycle, not the first cycle. In the first cycle, you are in learning phase. You're taking the lectures, you're learning the criteria, you start working on the projects. You will experience some mistakes with your work. Of course, we all went through this. And in second cycle, we have 2 sessions, and that's second cycle. We call tips and tricks. Sometimes you finish the entire practice or the 2 cycles without experiencing an open contact, for example, with fillings. So sometimes you don't get all the complications happening.
And it happens.
Like sometimes you don't experience it. So in tips and tricks, we have list of the most common mistakes that might happen and how to fix these mistakes. So people, they gather in that session, the 2 sessions, and they get to know all the complications that might happen during any practice and how to fix them, because they might happen in the
And
exam.
it's very beneficial, by the way.
It's very beneficial.
Yes.
But that doesn't mean you wait to fix your, like the mistakes until the second cycle. No, from beginning, from day one, from the first work check, when they tell you there's a problem here, let me show you how to do it, or you ask them how to do it, you go back to your station and learn how to fix it yourself.
It's very important because you can see the mistake.
Exactly.
You can see the mistake under the high magnification camera. You go to the lab. If you don't put your typodont on the mannequin head and check that mistake again and fix it, you're not going to learn how to do it.
No,
you're going to keep doing the same mistake every time.
What people do sometimes, they just throw the project that has the mistake and they restart a new one.
Yeah.
No, you have to learn also how to fix your mistake. But yeah, for tips and tricks, maybe you don't experience all types of complications. So we have them in a list and we will show you all the mistakes that can happen and how to fix them.
Okay. Now, after they finish the first 12 weeks of practice, we have a conclusion lecture that is going to be concluding everything.
Yes.
How important is this lecture?
Now, conclusion lecture is very important. This is on-site lecture, and it's going to be interactive because we will be showing like projects, photos of projects of people, of candidates, took our mocks as well. And it's going to be like us, everyone will be sitting, evaluating also these projects, what went wrong with these projects.
It's actually like a summary, right, for everything.
It's like summary, and we will review the most important points in each single project we took so far. It happens twice, in the first cycle and second cycle. So yeah, every cycle we have a conclusion lecture.
Okay, now let's talk about one more component. So after the 2 cycles or before your exam, you need to have your projects done. You have to do all of these projects at one time frame because you're going to an exam, right? So you have to do the exam is only 8 hours. So all of these 7 projects has to be done in 8 hours.
Yes.
So that's why some people, they do self-mocks and we do have the mocks already.
Yes.
So what's your advice regarding like how to manage the time and when to start doing the mocks?
Okay, so of course, like in each course, we will have practice and then there is self-mock, there is actual mock later on. The self-mock, usually people, they do them like you do the mock. You come to the lab and the plan is I have to finish the 7 projects for the work check, but I will do them in within an 8-hour time frame. Like the exam.
They usually have the time
they
with
do it on their own. We call it self-mock. Now the time is like here we will be, because in the first cycle, usually the self-mock in the second cycle. First cycle is learning.
Yes.
For the time management in the first cycle, maybe we don't focus much about it. We focus on quality in the beginning. So they have to produce projects according to the criteria, and we want high quality.
And we do have like a lot of questions. Oh, doctor, like how many minutes should I be finishing this project? And they're still in the beginning,
in the learning phase, especially the first 2 months. Maybe 3rd month they start to work on the time if they are good with the skills. Some of them they delay that working on time until the second cycle. Now in the beginning, quality matters. Later on, the time. The time here, you will learn how to manage your time through self-mocks.
Yes.
And with self-mocks, it's not random. You should also choose sequence of projects you're going to start with. Some people, they prefer to start with filling. Some people prefer to start with cutting.
I agree, yes.
So you should know which kind of, are you comfortable starting with fillings or cutting?
You should have a sequence for yourself.
Exactly.
And start implementing right away.
Exactly. And once you try a sequence and it works for you, that's it. You should stick with that sequence until the exam. So this is like time management. And the self-mock. So basically you're doing the 7 projects in the second cycle at your own. You prepare them for the work check. So instead of just taking random projects to the work check, you take like 7 projects, one
full
of
set
each,
of projects, yes.
exactly, to the work check.
No,
with the time
this is
frame
the
as well.
self-mock. The self-mock, you would be alone in the lab. Nobody is watching you. Nobody is checking your ergonomics, your position, the infection control.
Yes.
So you would be more comfortable. But once you take that to do an actual mock, it's going to be different.
Yes.
So the challenge is in the first mock.
Of course. So after you finish 2 cycles, the actual mocks start. And usually we tell people, finish the 2 cycles, you should have like a month and a half up to 2. It depends when they can get their seat, the exam. So in that period, after the 2 cycles, you start booking your mocks with us. The mocks will be in the facility here in Mississauga. We have for example, the B9 lab. Usually our facilities resemble, like we have all ADEC units and
like the same setup of the exam.
Same
we
time.
have it.
They start at 8:30. They finish by 5. They have that mandatory break as well. And there's invigilator.
They're going to be going around.
Exactly. So here
they're going to be adding more stress.
Exactly. So in the first cycle, learning phase, you learn the skills. Second cycle, you work on time. And once you are in the mocks, the actual mocks, here with self-mocks, you learn how to manage your time. But with actual mock, we add another important component, which is like here you will experience, yes, the stress because there is someone watching around as well.
That's why usually the first mock is going to be the worst.
Always, I tell them, don't
like
expect, never expect something like high expectations with the first mock, because yes, here it's time and skills and stress control.
Yes.
And usually, yes, it's not the best, their first mocks.
I don't know if you agree, but I always find it very beneficial if you can book one mock at the beginning. Early, just to see how it's going with you. After that, you take a break. Depending on when is your exam, you can take the sequence of mocks again.
And you can add always.
Just to know how it goes, because the mock that we're providing over here, they really resemble the exam. They have the same stations, the same way of taking the stuff out of from the cabinets, the same way of organizing your stuff. So because in the exam, it's not about performing the project. Sometimes it's about how you manage everything around you. So I think it's very beneficial, if you agree with me, like to take one at the early time. Then you can take
early, and then you can plan the rest of your mocks. It depends how many mocks you want to take.
Okay. After the mocks. This concludes everything. You're ready for the exam.
You're ready for the exam.
So now we covered all the components.
Yes.
You mentioned everything about how to get the maximum benefit from each component. Now, as a recommendation, how long do you think it's enough for practicing before going to the exam?
Now, on average, because I can't generalize this, on average, usually, if you can manage the skills with the time, skills in first cycle, time and skills second cycle, usually on average, people, they need the 2 cycles, which is the roadmap.
Yeah.
And then later on, you need month and a half or 2. It depends when is your exam for the mocks.
Yes.
Now, sometimes people, they struggle with skills because we are not equal with hand skills. We're not equal with time management. If you are still struggling, don't gamble with your exam. Take a third cycle. This is my recommendation regarding the time, but you can't know until you are in the second cycle. You will know. Once you reach to the level of time management, self-mocks, you will know if you need a third cycle. Mostly people, they go with the 2 cycles plus the time for the mocks.
Yes.
Yeah.
I think this was very rich information that you mentioned. Now, as a final advice for everyone.
Okay.
They're going to their exam, and what kind of advices you want to make for them?
Now that we know the component of the course, how to utilize each component, my advice is, first of all, consistency in practice, and learn how to fix your mistakes early, and how to evaluate your project yourself. This is number 1.
It's very important, by the way.
Yes.
Because on the exam day, you're going to be your own evaluator.
Exactly. You will
Nobody
be
is
the
going to be
judge.
doing a work check
Yeah.
for you. So you have to be your own judge in the exam. So it's very important that you know how to evaluate yourself.
Exactly. So this is number one regarding the actual work. Number two, time management.
Yeah.
And this is something you're going to work on it in second cycle with the self mocks. You will know how you are doing with the time management.
And time
The
is going to be
sequence.
better and better and better over
Yeah.
time.
It should be.
Yes.
And one more thing, because when we go to the exam, we are under stress.
Yes.
So time
Huge
is
stress, by the way.
important. And yeah, so we start to slow down when we are under stress. And people, you hear comments when they come out of the exam, they say, we used to do the entire mock within 6 hours. Now I don't know how the time went. And yeah, so time management is very important and you have to work on it. The most important component, which is equal to skills and time, is stress. You have to learn how to control your stress, because you hear, unfortunately, sad stories. I know someone whose work used to be a piece of like art. It was art. She went to the exam, and because she was so nervous, she prepared PFM. That I'm talking about ACS days, like back in the days. She prepared PFM on 1-1. She started with the labial surface on tooth 1-1.
Okay.
And then she prepared the chamfer, the lingual, on tooth 2-1. She couldn't, like, she failed that attempt, unfortunately, because of the stress.
Stress can
Otherwise,
do
her
everything,
skills were
yes.
amazing. Yeah.
Yeah, these are unfortunate like stories that you can hear.
It
I know
happens, but yeah.
stress is something that you always have to focus. You have to be calm. You have to go with to the exam with confidence that I did everything. Like I learned how to do the project. Everything in my capability I've done already. So you have to walk to the exam with confidence. I'm gonna go over there, do the exam, pass the exam, and leave, and that's it.
Yeah. So it's a skills, time, and stress.
That's everything. Thank you, Dr. Ban, for all of
Thank
this
you so much,
information,
Dr.
and thank you everyone who joined us, and see you all soon.